Hi everybody, my name is Natalie Bowl and today I'll be telling you about my research paper on aphasia. I'm going in depth into the Broca's and Wernicke's areas within this condition. Aphasia, the difficulty or loss of speech after a traumatic event occurs in the brain. So, damage is done within the language processing centers, which are located in multiple areas. It's the left hemisphere, temporal, frontal, or parietal brain regions. When the damage occurs, it's commonly by a stroke. There's two different areas that could be impacted, the Broca's area and the Wernicke's area, which I will discuss in detail later in this presentation. Stroke. So, aphasia is most frequently the consequence of stroke. When an individual experiences a stroke, parts of their brain lack oxygen due to a block of blood flow, resulting in damage. When a blood clot occurs within the brain, the loss of oxygen is detrimental to the functioning systems. The sooner an individual is identified as having a stroke, the less detrimental or deadly the damage may be. After an individual experiences a stroke, they may exhibit dysfunctional language, which you will see is common within these patients with aphasia. So, focusing on the Broca's area. Broca's area is located within the left posterior inferior frontal region. Individuals with traumatic damage within this area may often experience non-fluent aphasia. So this means that they have difficulty with speech, but are still capable of understanding the speech of others. Now moving on to the Wernicke's area. This area is located within the posterior superior temporal lobe. So traumatic impact within this area results in fluent aphasia, which is kind of the opposite of the Broca's area, which was non-fluent aphasia. So with individuals with damage in the Wernicke's area, these individuals can produce speech, but it's often incomprehensible. So they have trouble with making coherent sentences, but they do fluently, grammatically correct with their word choice. So, history of aphasia. The study of aphasia began in the 1800s with neurosurgeon Paul Broca, who identified evidence connecting the frontal lobe with the left hemisphere to non-fluent intact language comprehension. So later, Carl Wernicke, he came in and he defined evidence of a contrasting area of interest within the study of aphasia. This area within the temporal lobe would be connected to fluent dysfunctional language. Next, I'm going to be going in depth with some common symptoms of patients with aphasia within both of these areas. So with Broca's, when an individual is struggling with Broca's aphasia, their speech is often filled with long pauses that make conversation difficult. So these gaps in speech or verbal delays, they include like these delays such as and which make for frustrating conversations that feel never ending. So this is a word retrieval problem, and it's evident whether brain function displays anatomical evidence of brain damage. So when brain damage is present, these little word retrieval problems like not knowing what the problem is, searching for a word that might not be there. So it may also occur as a consequence of normal aging, and in this context, it's frequently described as a tip of the tongue phenomenon. So going into Wernicke's, within individuals with damage in the Wernicke's area, we see symptoms of speaking fluently and grammatically correct, but their collective speech did not make much sense. They show severe problems in understanding spoken language as well. So now moving on to misconceptions, a couple that I have here. Communication partners who interact with those dealing with aphasia may supply the needed word or provide other help in ending a sentence, but this choice may reduce the speaker with aphasia's autonomy by limiting self-repair and self-expression. In contrast, when the communication partner waits for the speaker to repair in their own time, it allows for greater growth and understanding from the individual with aphasia. This choice may be frustrating for partners as it slows the forward movement of conversation, but it's essential in providing appropriate support for those with aphasia. So next I'm going into the treatment approaches for aphasia. So there's two neuroimaging methods that are listed here that have given us more transparency when researching and treating aphasia. Functional magnetic resonance imaging, or fMRI, allows us to see clear images of the brain through blood oxygen signals. while Volex-based symptom lesion mapping measures structural brain damage from lesions of trauma. So neuroimaging methods such as these can map treatment-induced plasticity on the network level by combining different interventions such as speech and language therapy. So now we're moving on to the findings from these different neuroimaging. So this graph shown displays the results of absolute and relative fibers in individuals with aphasia before and after specialized treatment therapy. So treatment therapy meaning speech therapy. This increase shows the positive impact that specialized speech therapy has had on patients with aphasia, as these white fibers increase connectivity between damaged and healthy areas within linguistic brain functions. fMRI has allowed for the discovery of white matter plasticity in regard to brain damage, which has resulted in major discoveries in language recovery for patients. So, recent methodology has allowed advances expanding in VLSM to assess lesions on either functional or structural connectivity. This allows for linking the dysfunctional remote regions or white matter disconnection. So my personal assessment after making this research paper, when researching aphasia, I looked through I gathered 8 different research journals on this condition, and I gained insight into the brain's adaptability and potential for growth even after traumatic damage. Learning about this condition has really opened my eyes to how complex our speech and language processing is, and how fragile our brains are, especially with something as unpredictable as a stroke. This research has given me compassion towards individuals who struggle with speech, because it is difficult not being able to speak what's on your mind. And I now have a new perspective on how I should respond in these situations. Thank you all for listening. Here are my 8 different research journals that I referenced throughout this presentation. I hope you all learned something, and I'm excited to hear all your other presentations. Thank you so much.